Crossed eyes. In the first few weeks, a baby's eyes don't always work together. One eye may drift, or they may look cross-eyed. This is because the eye muscles are still developing strength and coordination. It generally resolves on its own. If you're still seeing significant crossing consistently after 2 months, mention it at your next baby's well check. Grunting. Babies grunt a lot. They grunt when they're trying to pass gas or stool. They grunt because the muscles of the pelvis needed to have a valve movement are still getting coordinated. There's actually a name for it, grunting baby syndrome. Babies will grunt, strain, turn red in the face, and sometimes cry. It's harmless and it usually resolves by 9 months. Spitting up. Almost all newborns spit up, as parents know. The valve at the upper end of the stomach, which is the lower esophageal sphincter, is immature and doesn't always close the way it should after swallowing. So some milk comes back up and goes back and forth. Spit up that is small, or it can be sometimes large amounts too, but it's effortless and it doesn't seem to bother the baby, just the parents. And despite spitting up, babies continue to gain weight. When to worry? When there's projectile vomiting, a forceful stream that shoots out of the mouth. That's different, and then particularly around a month of age. So vomiting that is green and or yellow. So these are reasons to call. Cluster feeding. This is one that sends many breastfeeding mothers seriously thinking about switching to formula because they think they're not producing enough milk. Cluster feeding is when a baby nurses constantly for hours at a time, sometimes during a growth spurt, and often in the first week of life, especially at night. It feels like the baby's never satisfied. It's not because you're failing. It's because the baby's sending your body a message to increase the milk supply. It's a biologically brilliant idea, even when it's exhausting. Day and night confusion. For the first several weeks of life, many babies have their days and nights completely reversed. They're wide awake at 3 a.m. and sound asleep in the afternoon. This is because in the womb, the movements during the day that you made would rock the baby to sleep. Now they're adjusting to external cues, light, sound, rhythm, and gradually with light exposure during the day and calm and quiet at night, their circadian rhythm starts to calibrate.